We're back. We got a familiar face back with us today. Good to
Great.
see you, brother.
Yeah, chow.
Hi, Joe. Yeah, that's right.
That's the only word I learned.
That's it.
Oh, yeah, and prego.
Yeah, prego.
Prego. That's not cheese, by the way.
That's right.
That means it's okay or thank you or
That's right.
whatever. Yeah, that chow means hello.
I mean, they answer the phone with it.
Prego. It sounds like cheese, doesn't it?
That's it. Grated Parmesan.
Yeah.
Anyway,
And the other one, and the other one was prosciutto. You know, you get the prosciutto's ham and prego is thank you or hello or whatever it is, and it sounds
Prego
the
for
same
the
to me.
prosciutto.
Yeah, right. All right. But anyway, it's very good.
Anyway, we're delighted to have Dr. Whaley back with us today. Had a great Friday last week with Dr. Ray Tidman.
I've told you before. You know, people say this ain't rocket scientist, but he is a rocket scientist. You did remember that, right?
Yeah, exactly.
Yeah, he's an astronautical, I can't even say it, astronautical engineer physician. Aeronautical engineer physician with some sort of specialty in, don't ask me. It's way past. I'm the guy that can't even work the cell phone, so don't ask me about aeronautical engineering.
We are here this morning. Brian is away visiting family, and we're delighted to be here this morning. This is our wonderful Ask the Doc segment, brought to you by North Georgia Cancer Research Center, associated with Northside Hospital. Every Friday morning, Dr. Whaley comes to us and shares some stories, shares his expertise, and if you want to ask the doc a question, you can always email it to info@fetchernews.com and put on the tagline, Ask the Doc. So let's get right into it.
I think our second question today is a follow-up of your discussion with Ray Tidman last week. All right, go ahead.
Yeah, we're going to talk some. Before we get into our question,
all right.
In the news lately, we've got a game show host, Alex Trebek, been with Jeopardy for 36 years. He was unfortunately diagnosed with pancreatic cancer, stage 4,
right,
which is pretty tough. He went through. He left the show for, I believe, 6 to 7 weeks. Does that sound about right for the initial?
Right. For the initial chemo, yeah.
Yeah, for the initial chemo, he left the show for 6 to 7 weeks, and he is back. And unfortunately, again, he announced to the audience that his numbers, and that's what I want to ask you about, his numbers came back way too high, and he's going to have to undergo a second round of chemo for his pancreatic treatment.
And he had lost 14 pounds.
14 pounds in 1 week.
1 week. Okay.
That's 2 pounds a day. I wish I could lose 2 pounds a day by accident, but I don't want the consequences associated with it.
No, maybe the second question about the flu. You could get that real bad for 2 weeks and lose 15 pounds.
I thought since that was relevant in the news, a lot of people watch that show, maybe you could give some insight into actually what he's going through and what he will face.
This is our first question, basically, anyway. Okay. So, pancreatic cancer is curable only when it is caught at an extremely early stage as an accident, generally, as I've said before. You go in for a bellyache and they think you've got gallstones, and they do an ultrasound and you find a tiny lump and you can get in there and remove it. Otherwise,
so when we talk about stage 4, keep in mind, stage 4 is...
It's spread to your lung, your liver, lymph nodes, or something else.
It's fully metastasized.
Fully metastasized.
Got it.
And that's the majority of patients with pancreatic cancer.
Because it's a silent killer.
Correct. And the average survival from the day of diagnosis to the day of death prior to modern generation chemotherapy was 6 weeks to 6 months. Modern generation chemotherapy puts a substantial proportion of those patients into a remission, and it did for him, that has a varying length of duration, and that length of duration in him was about 12 weeks or so, I think. But it can last as long as 18 months or longer, and I actually have patients taking low-dose non-chemotherapy that are 4 and 5 years out. They are the minority. They'd be 10% of the patients that were in Trebek's. So now that he's lost 14 pounds in a week, we're coming into this with our first question. His appetite's poor, his energy is poor,
He's probably suffering from some depression.
He's suffering from some depression. He does not mention pain, but he is probably having substantial pain and is having to take pain medication, which will dull his alertness. The chemotherapy itself is not going to make him sick, because we have enough medications today to prevent nausea, to prevent blood count falling, to treat blood count falling. We can't prevent hair loss, but everything else, so that the chemo itself is not going to diminish him a whole bunch. It's the progression of the disease that's going to diminish him, and it is very unlikely that a second line chemotherapy. If I've said on this program for 5 years, you get one bite at the apple when you treat cancer. Make it your best bite. I was shocked when they said they stopped treatment on him after 12 weeks, because I personally would have treated him continuously until he got the best possible remission, and then I would have pulled out any potentially cytotoxic medications and left him on the closest thing I could get to biological therapy, or easy therapy like athlete's foot or dandruff treatment, but I would never have stopped treating him. Now, I don't know that they did stop treating him. We just know that he came back to work. We don't know that he wasn't taking something else. I'm not trying to diminish what was done for him. I'm saying the way he presented it was, I took 12 weeks of treatment, 12 weeks, maybe not even been that long, and I'm back in the saddle again. Now, he may have been back in the saddle again and been on some suppressive therapy.
Now, when he comes back, and without getting into the weeds and getting too deep, just in general, when he comes back and he says, my numbers skyrocketed.
Okay. There, with a lot of malignancies, the one you're familiar with is PSA.
Right.
So you make a diagnosis for prostate cancer by PSA. If it starts rising after surgery, it's recurred in your body somewhere. That's your numbers.
Okay.
Okay. The number in pancreatic cancer is called a CA19-9. So that means it was elevated when he started, it dropped down into the normal range, and then it shot back up again, and it went way higher than it had been before. He said my numbers went up, and they were sky high, higher than they were before. That is directly proportional to the bulk of the tumor. So if you've got an ounce of cancer giving you a level over here, and the level doubles, then you've got 4 times as much cancer. Not double, 4 times as much, because that is inversely proportional to the square. So that'd be, if it doubles, it's 2 times 2, you'd have 4 times as much tumor.
Unfortunately, the situation that he's enduring, I mean, the morbidity rate is
100%.
Well, it is for everybody. It's just a case of how and when, right?
Correct. Yeah, but in statistical terms,
right.
Stage 4 cancer in second line treatment is 100% fatal. It's just a matter of time. If he gets a little bit of remission, he could have a few months. If he gets no remission, it could be quite short.
I know that he, expressed a desire to do the show 3 more years, and that's probably not.
That's not going to happen. No.
Okay.
I'm not sure.
We're not trying to.
No, we're not. We don't know anything about it. We have don't have his medical records. We're making statistical judgments. I doubt he's going to return to the show.
Yeah, I got you. Okay.
Okay.
Well, that leads us into our first question.
Lonnie, you got that first one?
What are some things I can do daily to help people regain her strength after chemo?
All right. First of all, that question is really, if you get it, first of all, this really says, what are things I can do daily to help my sister regain her strength? Well, first of all, we now know this is a female.
Right.
We do not know her age. We do not know the cancer. And we do not know what kind of chemo she has taken, which to me means that this may very well be a sister in Philadelphia and the patient is in Blue Ridge or down here in Jasper or someplace or other, because it would be absolutely unthinkable. You're thinking about our colleague who's in Pennsylvania, that a person would not be involved enough way back when to have been involved in the supportive care of the patient from the day the diagnosis was reached, or at least the day treatment was begun. So that's a really good lead-in from the Alex Trebek question. This first thing says symptoms in advanced cancer. getting chemo, we don't know if this is adjuvant chemotherapy for breast cancer or whether this is Alex Trebek. One of them over here is patient's just continuing to work full time and has to go to the doctor's office for a blood count one day, once in a while. And you know, you've known people up here who took it, you never knew they were doing anything.
Of course.
Except, oh, wait a minute, I can't go on Friday afternoon because I'm going to the doctor. And over here you got Alex Trebek. So the very top one, asthenia, that's not a woman's name, all right? Asthenia, that's just the whole thing of I feel tired and I don't have a whole bunch of energy. And then the second one is anorexia. That's Alex Trebek. I got 14 pounds. Anorexia means I don't want to eat. And then third is the pain. We're doing a real good job about pain. And then everything else in there is of small number. So you can pull that off, Lonnie. Put up that next one. This is where we should have been involved in this case early on. And this is just a brief outline. Starts up support. I'm going to get you one of those things like BKP has, where you can make see 3 different things at once.
Bifocals, yeah.
No, is that what they are? Anyway,
Bifocals.
Whatever. I don't know what it is, but if he hasn't lost them, he does a real good job of seeing every time. All right, so wait a minute. So supportive care begins on day 1. And that is, I mentioned that we have stuff for Alex Trebek that should prevent him from having various side effects in his therapy. But if you look at the third one, just for interest, sexuality in the patient treated for cancer, we are taking. You can pull that off. I don't want people focusing. I don't want to listen for a minute.
Listen up, folks.
We focus at the outset of the diagnosis of cancer, whether it's going to be surgery and radiation, whether it's going to be those immunotherapies, or it's going to be chemo like Alex Trebek, on the whole person. And so we begin right off the bat with how are you sleeping, what's the quality of your life, are you getting depressed, all the way down through that. It was nausea was there and everything else, all the way down to interpersonal relationships. And so it's not, it's something that you're going to be treated for 6 months. You discuss the sexuality of the individual, the relationships they have, and whatever's going on. So you would think that what can I do to help my sister get her strength back would have been
Long
page
time ago.
1. All right, so put the third one up. Now, I don't want you to feel bad.
Okay.
But you'll remember that I
good.
was one of the first people in this country to travel the United States giving talks about marathon training, weight reduction, and disease prevention. This is 1968. My talk I gave all over the world was called Life is a 5-Card Poker Hand and No Draw. Right?
Whatever you're dealt with,
Well, you got it. All right. So a guy that jacks a better game who's got a 10 high can beat a guy with a pair of aces if he can just bluff him well enough. So exercise, diet, and so forth will take a poor genetics and give you a good outcome. And the key to that has always been exercise, because exercise helps depression, it helps cancer prevention, it helps heart disease. Put up that. You got that one? Okay, now I don't expect anybody to read it. But this says the impact of exercise on chemotherapeutic completion rate. That means how well patients go through the entire planned course. A systematic review of the evidence and recommendations for future exercise oncology research. Okay, so this article was published this past week. But these types of articles, you can pull that down, Ronnie. These types of articles have been being published for years. We have patients that when they come in for treatment, and I'm treating a lady now that's 80 years old, who, when she came in for her first visit before she even had her surgery for breast cancer and began treatment, I always ask, what do you do for fun? She says, well, I'll go to the gym every day and I play pickleball 4 afternoons a week for 2 hours. 80 years old. 80 years old.
Great stuff.
So we sat down with her when we started, before she began, well, if she had surgery, she could play pickleball for a week. lumpectomy and axillary dissection, she was back on the pickleball court in a week. That tells you what kind of woman this was. So we sat down with that woman and we laid out a program of how she could get her exercise sessions in, how she could get her pickleball in, and get the blood count she needed and get chemotherapy missing the fewest number of things. And so she had to change her pickleball from 4 times a week to 3 times a week, and she had to cut her gym thing down and miss 3 sessions a week of the gym. And she literally made a calendar. So this family here, I would have thought way out then, would have been given advice about diet, advice about emotion. Somebody's going to have to help her with her housework because she's going to be off at the doctor's office, and somebody should go out with her for this number of minutes of walking or get her to the gym for biking or whatever level that person is capable of. Exercise would have been part of it from the beginning, rather than how can I help her get her strength back after chemo. Does that make sense?
Absolutely. So just to kind of capsulize, the modalities of treatment and the ongoing treatment should be established way on the front end.
Correct. That's a combined modality group. Yesterday, I had a patient who I got a nutritional consult now, hadn't even started treatment yet.
Right.
What you're going to expect, because they end up needing to have a feeding tube.
Right.
As we were taking a history, we got a history of 3 different kinds of cancer in the generation above him, not all breasts, and 2 different kinds in his generation. Well, that sounds more than random, doesn't it?
Yep.
So I ordered a genetics consultation for the guy. At the same time that we're doing a PET scan, and we haven't even started treatment yet. So before this guy even gets into it, he's got the nutritionist on the board. He and his family are getting, oh my gosh, because they're getting all the support they can get from a blinking geneticist who's going to sit them down and take this gigantic history. A lot of that is proactively supporting not only him but all of his family. And when we get to the point where he's get whatever drugs he's going to get, it's going to say, look, it's really important that you avoid alcohol, you avoid aspirin, you avoid nonsteroidals, or it's very important that you eat a whole bunch of cakes, cookies, and ice cream because we want you to keep your weight up, or it's important that you get some exercise and do this. So we'll be telling him different things depending on what we choose. For example, the lumpectomy and axillary dissection on that 80-year-old woman with the breast cancer who plays pickleball with that arm, she went to physical therapy on the 4th postoperative date for range of motion of her shoulder. So that's just a simple thing. All right, now that should be enough of that one. What do you think?
But let me tell you, that's good information though, because the folks out there, when they hear some of this stuff, it kind of goes like that. But if they can relate to somebody that they maybe are watching on television and know what that person's going through,
particularly Alex Trebek.
Alex Trebek. I mean, I think that's really, really good information.
Yeah, we had a good discussion here a few weeks ago about brain tumors, and there's a lot of brain tumors, and wearing this device on the head. Remember? Well, I saw a patient the other day at Ingles Supermarket wearing a device on the head, and with the family and everything, and people would ask them about it, and there's a lot more social acceptability,
social interaction.
Well, and you see the women with the turbans on their head. They used to all wear a wig, trying to hide the fact they were getting chemo.
Now it's almost a badge of courage.
Almost, yeah. They either got a ball cap on or they got a turban on their head. They said, "Look, I'm getting cancer treatment, and I'm not hiding it from the world." I think that's a good thing. Okay, go ahead.
Anyway, second question, and again, this segment is brought to you by North Georgia Cancer Research Center, associated with Northside Hospital. Last week, Dr. Ray Tidman and I talked in depth about flu shots, how the CDC develops them, and just kind of the whole genesis of the annual flu shot. And you go to the bank. This question is, and
he said
he did.
It's just like surgery. I give my patients the information.
Exactly.
And I let them make their decision.
Right.
Now tell me this isn't a follow-up of that session.
I'm a 60-year-old female, and my daughter says flu shots cause disease and have poisons in them and do not work. And Dr. Whaley will say to that,
baloney. All right.
there you have it. Okay,
Well, okay.
got that one done.
We got to get him a pair of BKP glasses because the question says I'm a 67-year-old female.
I thought
See,
I said that.
60, you said 60. We got to get him a new pair of glasses.
67,
I
okay,
keep telling
okay.
you. All right, show the first one. We're really talking about the severity of this year's. You've got the info on how the CDC makes the vaccine.
The vaccine's out there. They take the top
Yeah.
5. They make this little concoction.
Yeah, I've got some more of that, but I mean,
Yeah.
I'm just going to touch on it
Yeah.
at the end. But anyway, so put that first one up, Ronnie. What does that say?
The flu forecast.
All right.
Flu
now-
season is approaching.
Okay, all right. Now just leave it up there. Are you ready? It says. Okay. Now you remember when the hurricane season starts, NOAA, whoever that is, says we predict 11 named storms this year. It ain't a storm out there yet, right? Well, how are they making that prediction? All right. Question is, well, how do they have the foggiest idea what the flu season is going to be like? Lonnie, show number 2. We're going to put this up for just a minute because there is so much misinformation out there. Lonnie, I want you to listen to this. Every time your nose runs,
My nose is running down.
every time you get a headache or a temperature of 99, you do not have the flu. There are approximately 100 viruses that cause a cold-like, flu-like mild illness. I mean, Zika, everything else that's more severe. The flu is basically sort of like dengue fever. You have a real fever. You hurt like you've been banged with a daggum 2x4. You have a real headache. So you don't even worry about the flu until it's so important in cancer patients, immune suppressed patients, and patients over the age of Tylenol and ibuprofen. What does it say?
Get treatment within 48 hours.
If you don't start treatment with Tamiflu within 48 hours, it ain't going to work. And you are going to have the same amount of flu for the same length of time you would have had anyway. All right, now we're going to get rid of both of those. Show him that map, Lonnie. This is last year's flu epidemic. See that bright red color right there?
Yes, sir.
What does that say? Flu activity at the very highest. That
Yep.
was the very top. What color is Georgia?
That'd be red.
That'd be bright red. That was last year's flu. We had a severe epidemic of flu in the Georgia last year. If you saw that map from the year before, what color was Georgia?
I don't remember.
It was bright red. Now, Lonnie, the next question. Here, how did those guys at NOAA predict 11 numbers of storms? I have no idea. Here is how we're ready to tell you you're going to have a hell of a high flu epidemic this year. Why do I know that? What? No. The flu epidemic has already started. Where did it start?
Down under.
Down under. It starts
Australia.
in the southern hemisphere. It's springtime down there, boys. It's April for them. Now, watch this. This is May 19, June. That is the flu epidemic in Australia compared to the last 10 years. You see that black line, Lonnie? Does that show the top line? All you got to know is that's flu activity compared to the last 10 years. Well, look where it is between January of 19 and May of 19. May's just a couple months ago. It was right along the level that it's always predicted to be. It has just spiked. That flu epidemic will be in this country in how long? A couple of weeks.
Yeah.
Couple of weeks. All right. Now,
So the takeaway from that is
It's coming. And if you just use the history here, it's going to come to Georgia big time. All right. Next, throw that next one. This is a brief thing of the fatality rates. Now, how many people, we could just pull that down, how many people die of the flu in the average year in the United States?
Dr. Whaley,
I've said it before.
Shoot in the dark.
Shoot it.
5,000.
30. How many died last year?
30?
80.
Yike.
80,000 people died.
Nationwide.
Nationwide.
Or worldwide.
No, nationwide.
Nationwide.
Okay, now that is people of our age who aren't as in good a shape as a teenager, or the people who have some diabetes or something like that. There is no fatality rate to taking the flu shot. There's basically no expense to taking the flu shot. I mean, you get it free at the public health service. We've already missed it, but around here, 1 week they were giving them away free at the banks. You know, another week they were giving them away free at the health centers and everything. So if you'd paid attention, I think last week and the week before last, you could have gotten free flu shots around North Georgia.
All right, full transparency here.
All right.
I took your advice and I got the 2-stage shingle shot.
Oh, good. You're going to be in great shape for that.
Now, as I said last week with Dr. Tidman, I've never had a flu shot in my life. But then again, I've never had the flu, so I don't know whether it's chicken, egg, or egg chicken. However, you got me a little bit nervous.
Okay. Now,
Should I be?
I would be nervous. I want to say a little bit about the flu vaccines. Put up that next thing. Ray gave you the Reader's Digest edition of the.
Man, this is not a thumbnail sketch here, folks.
Well, anyway, so he gave you what you really needed to know, and that is that there are about 5 different ways you can give the vaccine this year, including a live one you can sniff in your nose you don't want. You're over 65, over 60, I'm over 60.
I'm way over 65.
Well, all 4 of us adults here are over 65. We should get the high-potency, multivalent flu vaccine. They are not made in eggs anymore. So you can't go in there and say, oh, I got an egg allergy, I can't take. They aren't done in eggs anymore. So that excuse will not work. And
what do we ask for?
You just ask for the big boy flu shot.
Big boy flu shot.
Or I'm 65. I want the 65-year-old flu shot.
Okay.
And it ought to cost you $10 or something like that
Okay.
with your Medicare. Or maybe nothing with Medicare. I mean, I don't know. I'm not on Medicare. Well, you know, we could. Back in the day, I used to bring flu shots home, give them to the hockey team. I mean, why do the Braves and the NFL and all that give every player a flu shot? They don't give them a choice.
No.
Okay, you'll remember.
got a lot to
You'll
embrace.
remember the next to last year that the Thrashers were here. The Montreal Canadiens had to bring up a minor league team
I remember.
to play 2 games because over half their team was incapacitated. They just brought up a minor league team, put on Montreal jerseys, and played 2 games.
There you go.
So if you have a business that depends on people being there and you don't want 10 or 15% of them out with a temperature of 103, you give flu shots for free. Delta gives them for free. UPS gives them for free. That should tell you something. If a big business gives them to everybody for free, it's worth taking.
Yeah.
All right.
All right.
Now we got to get on the news because I know
We
we're
gotta
running
get on
out
the
of
news 'cause
time.
we got to get out of here. All right.
I got the people that.
I don't know the exact verbiage that BKP uses, but he said, you know, every week we end this segment with Doc getting into the news and telling us what is absolutely cutting edge current stuff.
Right, and this is flashback. Okay, now I don't put these. This comes right out of the. This is the exact order that the news articles. By the way, there are 4,000 news articles this week. We're just going to look at the top half of them here. Top few of them here. What's the top one say? And you heard it first on this program about 6 months ago.
More U.S. teens vaping nicotine.
All right.
Media giants pull e-cigarette ads. New York State first to ban flavored e-cigarettes.
Now, the first five news things this week are related to that vaping business. We began way back when they had the problem here in the high schools last spring. There have been 8 deaths as of today, 9 deaths as of today that are officially related to this because the CDC is in the ICU with those people. They believe there are probably hundreds more. There are 800 people out there with the diagnosed disease, many of them in the hospital on ventilators. Most of them are young. I mean, teenagers and young adults, and there are going to be a whole bunch more deaths. So I'm going to tell you, you're going to see this vaping industry drop off like crazy. It may well be that they ban e-cigarettes, or I mean, it's really a big deal. And so you got a teenager around here going to the 7-Eleven and buying a thing that looks like a computer stick and sucking that stuff. You need to snatch it out of his hand and snatch him bald-headed.
We need to do a whole segment on this because the questions I've got are just off.
Yeah, they're legion, aren't they?
Yeah. Yeah.
Okay, well, I've been talking way back when I had the Ask the Doctor radio program 30 years ago, and the cell phones were just coming out, and I was telling people, take the cell phones away. I want you to read just that headline right there.
Intense gaming can trigger irregular heartbeat, fainting in some players. Did you hear that, Lonnie? Intense gaming. I asked him this morning, he doesn't do any gaming, does he? He said, whoa. There's your candidate across the hall.
Okay. The epidemic in young women, like Destiny's age there, is that they take their phone to bed with them and then they text in the nighttime and they get poor sleep. So their sleep is not good because at 3 a.m. some friend texts them some darn thing. And that's why the phone ought to stay out there with mama from 9 o'clock at night till the after breakfast in the morning. And that thing, the phone for those adolescents and young people is to call emergencies, to call home when your ride doesn't show up, not to stay up at 3 o'clock in the morning. Now, I've got grandkids that watch stuff on things and play with this. But there are people who become addicted to this gaming to the point that they do games longer than 30 minutes a day. I mean, some of them might do it an hour a day. Is that 2 hours a day?
On off days, 3. On off days, 3.
On an off day, 3 or 4 hours. Okay, well, the point I'm making here is that this actually has a physiologic outcome. Now, as I watch these ads, my wife says, "Oh, that's what you say? It's a satanic or something." There's a lot of shooting, and or a lot of stuff, and they jump out and they well, that raises your heart rate and raises your blood pressure because it's just like you're out there in the street having a fight for your life, and it can cause cardiac arrhythmias, it can cause anxiety, it can cause anxiety disorders and interfere with your sleep. Is that because you've been over so much? Yeah. Oh, yeah. Kids are getting bent necks, bending over too much. All right. That's yeah. Oh, I didn't know something else.
That's
all right. So that's enough news. We don't want to cut into the expert panel here.
Well, anyway, this is really, really good stuff, and I guess I'm going to get a flu shot.
I hope so.
Based on what they're doing and based on what's going on
in Australia.
In Australia, did you get a flu shot?
Oh, timing. Don't get it too early. I would get mine the last week in September or the first 2 weeks in October. Well, we're there now.
We're there.
Back in August, I said, don't get it yet.
Okay.
And the CDC said, don't get it in August or the first 2 weeks of September, so now you can get it.
Okay. All right.
Go to Australia for 6 months.
Yeah. It's always good to have Dr. Whaley back. He brings such great information, and we covered a lot of ground today. Again, this segment was brought to you by North Georgia Cancer Research Center, associated with Northside Hospital. Good to have you back.
Thank you.
Great
back.
Segment today.
No train whistle today.
No train whistle today. No delivery man. We're saving that for the All-Star panel. Anyway, Bruce and Jane will be with us here after the break. So, Lonnie, appreciate you being here. Take us to break.